Obamacare. It was a travesty, an abomination, a big government takeover of health care. We did not want it. We could not afford it. It should not have happened. Now the Supreme Court has spoken, and Congress needs to clean up the mess. No more raids on Medicare. Let doctors, nurses, and healthcare professionals make the medical decisions, not big government. The way it should be. I'm Vernon Parker, and I approve this message.
And welcome back to Sunday Square Off. Joining me now is the Republican candidate for the 9th Congressional District, former Paradise Valley Mayor Vernon Parker. Welcome, sir.
Thanks, Bram. Thanks for having me. Really appreciate it.
Again, we'll follow the same format as with Kirsten Sinema, discussing the bigger questions facing the country and the district in the first segment, then taking a closer look at your political career in the second segment, and you'll also have your 30-second elevator speech for the voters. Let's start with the district. What can you do as a member of Congress that would help address specific needs in this 9th Congressional District?
Well, we have to bring jobs, Bram, and I believe firmly that our message of job creation, we have a 16-point job plan. If you go to vernonparker.com, you will see it. First of all, the first point that I really believe that we should do is freeze the current tax structure. If we do that, we will be putting $4,000 in middle-class pockets for 5 years. The second thing we should do is address the corporate income tax, because I know people say that my opponent saying, well, Vernon Parker wants to decrease corporate income tax. The president wants to. We cannot compete on the global scene with one of the highest corporate income taxes in the world. If we reduce it to 22%, we will bring jobs, 2 million jobs here to America.
I want to bring it back to what a member of Congress can do for his or her district. The 9th has specific needs. It's a diverse district, some significant institutions. What are, again, the specific needs in this district that you think you can help with as a member of Congress?
Well, first of all, once again, job creation, but second of all,
specific needs in the district.
Specific needs in this district. We need to make sure that we complete I-11, that we get I-11, Interstate 11, which will bring jobs to this district.
And for refresher for folks who don't know what I-11 is?
Interstate I-11 is a highway from Las Vegas to Phoenix, and I believe that when I go to Congress that I'll be able to assist in getting that done. The other thing that I really do believe that we can do specifically for this district would be to make sure that once again, we keep Luke Air Force very strong.
Luke Air Force Base is in Glendale.
Yeah, it is in Glendale. However, a lot of the residents...
Can you say, name something specifically in this district?
Specifically
in this district? An institution, something a Mesa need, a Phoenix need.
Well, Bram, jobs. Jobs. I mean, we keep going back and forth on this, but the creation of jobs. We cannot compete on the global sense. We cannot compete in the state of Arizona if we do not have sound national policies to bring jobs back to this state. Okay. So it has to be, we have to create jobs for the middle class, and in particular, we also have to make sure that we preserve our commitment that we have with our seniors. And
okay. We'll get to that in a moment. I want to talk about a big issue that any member of Congress is likely going to have to face, and which you would likely face if you took office in January, the fiscal cliff.
Yeah.
Big cuts coming. What is your formula for helping the country get around those the fiscal cliff? Revenue increases, tax increases, spending cuts. What's your formula?
Well, first of all, I would work with both parties to make sure that when the fiscal cliff does occur, that it does not impact the country the way it's going to. I mean, a 15% cut across the board is going to be devastating. We are going to have small businesses hurt here in the state of Arizona. The military will be devastated. And so I have already spoken with members of Congress right now, and we have already said that once that between the transition period between when we get elected and now, in between January, that the members of Congress will work with both parties to make sure that this fiscal cliff, and hopefully make sure that they can work something out.
Okay, what's your formula?
My formula is...
What's on the table for you? What's off the table for you?
Off the table for me is military spending, because...
Do not cut military spending at all.
Not across the board. I'm not saying that we don't touch military spending, but it has to be in a constructive way. Look, when you are deciding your own budget in your own house, you just don't take a machete and say, I'm just going to take off 15%. You identify which areas you believe should be cut first. And I think that there was a huge flaw when the sequestration was first implemented, that they should have had a provision in there to say, let's look at the vital things and let's keep those vital things vital, and let's keep those things there, and let's just not go after a 15% cut across the board. And the other thing, Bram, is that, you know, we should not be we should not be increasing taxes right now. That's just not going to work.
Do you see any revenue raisers, whether tax increases or other mechanisms, any revenue raisers that need to be part of getting over this cliff?
Well, in order to get over this cliff, once again, we cannot take the draconian measure to say that we're just going to just come in and just...
Do you see revenue raisers as part of the solution?
Everything is part of the solution, absolutely.
So yes to revenue raisers, tax increases?
Well, that's the last measure that we should ever take. When I was mayor of Paradise Valley, we had to cut our budget by 30%. I mean, we did. We cut our budget by 30%. People told me, raise taxes, raise taxes, raise taxes. We took a scalpel and we carved out specific things that should not be in our budget. And instead of raising taxes, we cut our budget by 30%, Bram, and that's the exact same thing that I believe that should be done on the federal level. It should not be a machete, it should be a scalpel.
A scalpel on a massive
absolutely.
Budget.
Absolutely. You have to start somewhere. I mean, you just can't come in and just start.
Let's talk about the Affordable Care Act. We saw that commercial of yours a moment ago. You called it a travesty. You've also said, though, you'd like to retain the law's requirements of health care coverage for older children, as well as coverage for pre-existing conditions. So, travesty, get rid of it, but retain it. How do you do that?
Well, it is a travesty in the sense that it robs our seniors of $716 billion in Medicare. It does.
Okay, can we do away with that? Because that's been fact-checked. That's been fact-checked to death.
You can fact-check it to death. I'm not going to do away with it, Bram. It does.
Okay, can you explain this repeal and retain? How would that work?
Repeal the portions that I believe are detrimental. It's detrimental that in America today, if you are a small business and you hire someone, if you hire more than 50 employees and they work more than 29 hours a week, that you will be penalized. I have had a jobs tour. I have gone from small business to small business, and they have told me, Bram, I'm not hiring full-time now. Now, we can't get our economy going if we don't have employers hiring full-time. And the most vital part is that we are taking the decisions that should be between a doctor and a patient, and we are giving it to a 16-panel board in Washington, D.C. with bureaucrats. And the other thing that people never talk about is this. They don't talk about tort reform, or they don't talk about frivolous lawsuits. I told you, my wife had third-stage breast cancer. We lost our health coverage because we could not afford it, but she survived. And when we went to the doctor said, look, she needs this test, and this. Just give me 5 more seconds. She went to this test, and this test. And I said, we can't afford that. We're paying it. And he said, well, you really don't need this test. And I said, why'd you prescribe it? He goes, I'm afraid I'm going to be sued. So doctors are practicing defensive medicine instead of preventive medicine.
So yes or no, do you want to repeal the whole thing?
No.
You do not want to repeal.
I want to take
that ad you said you wanted to.
Yes.
Now you're saying
no,
you don't.
No. I'm trying to be upfront with you and say, look, there are certain portions of it that I believe we should retain. And there are 2 portions in particular. One is that we should retain that families in the most healthy part of our population, if parents want to provide health care coverage for them up until the age 26, because they can't find jobs now, so they may as well be
plus pre-existing conditions.
Right. So if I say repeal the whole thing, then you got me on that one, okay? So I cannot say...
I don't got you. That was your ad.
Well, my ad, if you listen to what I'm saying in the ad, that I did say that there are some portions of it, if you go...
Not in that ad.
Well, not in that ad, but in our conversations, Bram, and then in my written statements. If you look online, you will see on my website, vernonparker.com, that I do talk about retaining the portions that are good. We don't throw the baby out with the bathwater.
Okay, got to end it there. Great discussion. When we come back, a closer look at Vernon Parker's political career. Stay with us.